Havaka, we were supposed to go. Acha, we are live now.
Sorry, guys. But I just thought
I
didn't want
गर्मी
to.
असर तो डालती है, गर्मी भी असर डालती है.
I think so, guys. We are live.
हाँ, एक बार सभी उसमें हम डाल दिया ना, ग्रुप्स में तो आ गया है सभी में.
हाँ, सब में आ गया. आज तो वृंदा ने सब में डाला. She is, oh my God, so many times I have received it.
Imagine, this is the problem that I want to avoid. So many of them are in multiple groups.
नहीं, which is okay. पता है, ऐसा लगता है कि काम कर रहे कहीं पहुंच तरह.
Chalo, see you girls. I'm leaving.
अरे सुनिए, आपने मुझे, मैं होस्ट हूँ कि नहीं हूँ, दिखा दो जरा.
मैं बना रही हूँ.
अभी बनाएगी ना, before going.
नहीं, एक बार बना चुके ना, वो वापस से उनको बनाया था.
Because I said I'll take us live. That's
Yes, we are live.
Girls, remember we're live on YouTube. Remember.
Yes, I do.
Ma'am, Rashmi ma'am, you will remember. The problem is the three of us forget. So.
Got it पे जब क्लिक करते हो ना आप, तो वो 2 बार रजिस्टर करने से बात करती हूँ मैं क्लिक. So she, डॉक्टर गीता से भी बात हुआ था. She might join anytime now, है ना? पारुल, आपको दिखेगा, because I'm not able to see how many are there.
सैमी को co-host बना लेना.
आपका लैपटॉप चेंज नहीं हुआ है?
नहीं, आप पारुल, आप क्या सैमी को co-host बना दो.
नहीं, मेरा हो गया. My laptop is repaired.
मैंने co-host बना दिया आपको, सैमी.
हाँ, now I can see Manas and Ashish.
ठीक है, चलो, I'm leaving. Bye bye.
Okay, bye. हमारी तरफ से भी मत्था टेक के आना.
Yes.
जरूर.
Ask for blessings for us also.
Yes, we all need it. I can tell you that. Hey girls, I want you to. Sorry, girls, I want you to talk about the camp at Baramulla today. It went out very, very well. Almost 10 doctors had come, 10 specialists from across.
You are talking right now. Yeah. Please carry on.
So they had all come, and Mumtaza ma'am said the program went off very well. The district collector was supposed to come, but she did not come because of some other meetings that came up. But we had the chief education officer and the chief medical officer of Baramulla at the meeting, and we had and the meeting went off fantastic. There were 70 children with various disabilities, including Down syndrome, who had come, and the doctors saw them. Parents were very happy. They want a center specifically for Down syndrome in Baramulla, which we will discuss once the meeting report comes in. But I want you to inform all the parents who've come that Baramulla mein abhi hum log Srinagar gaye the. That's when this plan itself originated, and it's like things moved so fast.
Yes.
इसका वृंदा जी कौन सी
Welcome Dr. Geeta.
आए थे डॉक्टर साहब.
Welcome to our session. हाँ, बोलो कौन डॉक्टर आए थे?
हाँ, जैसे ENT के थे.
हाँ, pediatricians थे, developmental pediatricians, फिर ENT थे, cardiologist थे, and then there were also some special educators. मेरे को पूरी list आई नहीं है, but there were about 10 doctors who had come, and therapists had also come, because the chief education officer of Baramulla was also there. So they wanted to bring in special educators. So.
Okay.
Yeah. Okay. Thank you, Geeta ma'am, for coming at such a short notice.
For calling me. Honored to be here.
I'm so
Hello, Dr.
Thank you so much. We are blessed. Chalo, bye. I'm leaving, ma'am. Sorry, I have to leave.
Dr. Geeta, would you like to try your presentation, screen share and all? Parul, आप एक बार उनको co-host के rights दे दो.
My angel is with me now. She can help me though.
Lovely. Today, Parul, I might inform you that she is not in Delhi. She is in Bangalore, and we were like, koi baat nahi, we will plan again when you are out of place. Then she called back and she said, no, I will be there. So
thank you very much, doctor. Thank you very much.
No problems. I'm audible actually.
Yes, you are audible. Yeah, there's some screen visual distraction. I mean, a little distort it is getting and then getting fine, but your audio is very clear to us. Yeah, we can see the screen.
This is distorted. कट कर देते हैं. Sorry.
Screen is visible, ma'am. Yes, ma'am. The screen is visible.
Right. So should I off it or let it be like this?
No, we will off it, and once we
Off it
hand
once,
over
no?
to you, yeah.
Yes.
Then
I did. Thank you.
हम बस 2-3 मिनट और वेट कर लेते हैं डॉक्टर गीता, कुछ लोग और
No
आते
problem at all.
हैं, स्टार्ट करते हैं. आपकी स्क्रीन में ये डिस्टरबेंस क्यों आ रहा है डॉक्टर गीता? जब आप आए थे तब तो एकदम क्लियर था.
अभी जो आपका वीडियो विजुअल आ रहा है ना, उसमें बीच बीच में वो डिस्टॉर्ट हो रहा है.
हाँ,
Yeah,
अब ठीक
yeah.
है.
It looks better right now.
ये फिर से वही हो रहा है.
Where it started. It started fine, but now it is again.
वो ऐसे सैमी जो पहले वीडियो के वो टेप नहीं आया करते थे ना, टेप में
Yes.
कुछ स्क्रैचेस वगैरह आ जाते थे, तब ऐसा
Yes,
आता.
yes. VCRs में we used to play.
VCR.
Then it used to get stuck ना, reels वैसे हो रहा था. Yeah, right now.
मेरे ख्याल से मैं एडमिट कर लूं, है ना?
I think we should. Dr. Geeta, अभी तो the screen is very good. Right now, the visual is very good. You're on mute. Yeah, it's happening. I mean, it's.
Should I leave and join again once?
ओके, ट्राई कर लीजिए आप. और अगर ऐसा भी रहता है तो इट्स ओके, कोई बात
It's
नहीं.
okay because by the in a very short time we'll have your screen, bigger screen and presentation. So that will cover, and I think वही हो रहा है. It's beginning, it is starting fine, and now your visual is fine, but that little.
हाँ, कुछ आ रहा है. And what's that? That's not a picture. My Wi-Fi is also, I think, fine. Let me leave and come back again.
जी जी जी.
Okay, no worries. We'll wait for you. Till now, then we speak for.
हाँ जी समीक्षा.
Yeah.
तो समीक्षा, रश्मि मैम, हम स्टार्ट करते हैं प्रोग्राम.
Yes, I think we should.
थोड़ी सी स्पॉटलाइट ले लेते हैं.
Yes, please, all. मेरे को समझ नहीं आ रहा है मैं कैसे करूँ.
दोस्तों नमस्ते, मैं पारुल. शनिवार के हमारे आज के सेशन में आपका बहुत बहुत स्वागत है. आज का हमारा सेशन बिल्कुल मेडिकल ग्राउंड पे हम फिर से लेके आए हैं, और बहुत सारी क्वेरीज हमारी ENT से रिलेटेड होती हैं, अपने बच्चों को लेकर और हमको खुद को भी लेकर. तो उन सब पे हम बात करेंगे अपनी गेस्ट से आज. उससे पहले हम आपको कुछ बताना चाहते हैं. बारामूला में आपने देखा होगा लास्ट मंथ में कश्मीर में हम लोग कुछ गए थे रेखा माँ के साथ, और वहां पे कुछ पेरेंट्स से हम मिले थे. बहुत ही जल्दी वहां पे बातचीत हुई लोगों के साथ, और बारामूला में आज हमारा वहां पे मेडिकल कैंप हुआ है जिसमें 10 डॉक्टर्स ने हिस्सा लिया है, और लोगों ने उसमें बढ़ चढ़ के हिस्सा लिया है. जो वहाँ के अथॉरिटीज हैं, ब्यूरोक्रेट्स हैं, वो लोग भी काफी अच्छे से आए हैं, और पेरेंट्स ने भी उनका भी जो सहयोग रहा है बहुत ही अच्छा रहा है. करीब 10 डॉक्टर मेरे ख्याल से समीक्षा वहां आए हैं. तो आप उसके बारे में कुछ बताना चाहेंगी हमारे दोस्तों को?
Yeah, the camp was scheduled for 3rd June, and which was the after effect of Moms Meet last month in Kashmir, and it went very well. In that Moms Meet also we had disability inspector of Kashmir with us, and in this free camp, rightly Parul mentioned then that it was organized, of course, under the banner of Down Syndrome Federation of India. And the Chief Education Officer and Chief Medical Officer of Baramulla were also present in it, and everybody was, participated in a high spirit, and they felt overwhelmed. And the report is yet to come, but we could hear the excitement and the satisfaction in the voice that it went so well that they would want it to become, a regular feature in future also.
बिल्कुल बिल्कुल.
So for that, thank you, mothers. You really could create that wave that it is happening in Kashmir also now. Parul.
बिल्कुल. दोस्तों, इसमें कोई शक नहीं है कि जो रूबरू बात होती है डॉक्टर से, जो रूबरू उनसे कनेक्शन बनता है और वो देख पाते हैं, वो अलग ही होता है. लेकिन यहाँ भी हम कोशिश करते हैं कि हमारे गेस्ट आए और कम से कम आपको एक दिशा दे पाए. आपका जो मन में भ्रम है कि मुझे किस तरफ जाना चाहिए बच्चे को, या हमें क्या प्रॉब्लम है, और कई बार कुछ ऐसी छोटी चीजें होती हैं जिनके लिए आप डॉक्टर को जा भी नहीं सकते हैं, तो उस सब के लिए हम यहाँ पे कोशिश करते हैं कि आपको हमारे जो स्पेशलिस्ट है डॉक्टर्स, उनसे मिलवाया जाए और आपकी क्वेरीज को यहाँ पे खत्म किया जाए. उसी सिलसिले में आज हमारे साथ बहुत ही हमारी जो है हमारी दिल्ली की बहुत ही प्रसिद्ध जो है ENT से रिलेटेड जो इश्यूज से डील करती हैं डॉक्टर गीता कथूरिया हमारे साथ हैं. डॉक्टर, थैंक यू, आप दूर से भी हमारे साथ जुड़ी हुई हैं. तो मैं आपका अपना टाइम ना लेते हुए सीधा ये जो है प्रोग्राम हम स्टार्ट करते हैं. समीक्षा से स्टार्ट करती है, और जैसा कि हमेशा होता है डॉक्टर अपनी प्रेजेंटेशन देंगे और उसके बाद आपके जो भी सवाल हैं हम फटाफट से आपके सवाल लेना शुरू कर देंगे. समीक्षा.
Yes. Good evening, everyone, and welcome in today's session. And as Parul rightly mentioned, that we try to bring in all the experts, and it is a proud moment to report that all the experts have been with extensive experience in their fields. And today also in the same sequence, we have with us Dr. Geeta Kathuria ma'am, and she has come with on this platform previously also, so she might not be a new face for some of you, but those who have joined for the first time or listening this later on for the first time, I wanted to just mention that with us we have today a very experienced and very passionate ENT specialist, Dr. Geeta Kathuria. Her hallmark of excellence is that for her work and dedications towards giving care to the patient under her, she has been awarded many times, be it Indian or foreign soil. She is a noted doctor in Delhi, presently as director in Ananta Care. In her center, her entire team render care for all kind of neurodiverse needs, covering many areas of concern such as speech therapy to occupational therapy, ABA therapy, behavioral management, and even special education. She has been associated with many corporate hospitals and comes with a very, very expensive experience, and has many publications to her credit as well, and many awards and accolades to her account. We express our heartfelt gratitude and appreciation to her that on a very extremely short notice she agreed, and she is also right now out of Delhi and still able to support us here. Thank you so much, ma'am, for that.
Thank you very much, doctor.
Yes.
Thank you.
We all know that being in different location might bring in issues like connectivity problems and all, but we really want to applaud your spirit to contribute, and still managing the all technological aspects being away from your hometown. A very warm welcome to Dr. Geeta Kathuria. Ma'am, over to you without further ado.
Thank you all for this, and it's actually an honor to be part of this platform. I'm really privileged to come in contact with you all and all the parents of who are connected to DSFI, and if we are of little help also to them, I'll feel that I'm really privileged and honored. I'll not waste much of the time because I want to go into a small presentation, and then we'll answer whatever the queries I can satisfy.
जी.
Ma'am, you have disabled
Parul,
my
again, you have to make the co-host because ma'am has joined again.
Okay. Yeah.
Thanks.
Yes, ma'am. No, you are good.
there.
Yeah, I think you'll be able to do. Yes.
Is the screen clear?
Yes, ma'am. We can see the slide.
Right. Okay, and I'm audible to voice is clear?
Yes, ma'am. Voice is also.
Sorry for this disturbance. I don't know why it's there on the video. Okay.
It's looking like a kind of a effect on your visual, so it's okay.
uh, so again, good afternoon, everybody. So today I'll be dealing with ENT perspectives of Down syndrome and the issues what you all are facing and what all my staff kids, my self advocates are facing. Right. So I know currently the audience is mix of the new parents and those who have already spoken to me. I'll try to recapitulate a bit and bring some new aspects to the previous presentation. So the Down syndrome, as we know, it's a genetic disorder where the abnormal cell division happens and an extra chromosome comes in at number 21, and it's a 21 trisomy, which leads to developmental and intellectual delays, right? So it has different variants like trisomy 21, which is the most common, where at the 21 location, we have 3 chromosomes. And another variation, which is 3 to 4%, is a translocation, where the genetic material translocates and there is an extra genetic material in the chromosomes, which lead to similar presentations. And mosaics are very little 1% who have mixture of the trisomy and the normal. So the symptoms are slightly lesser in this variant. Right. So why are we actually concerned about Down syndrome? Because it is very commonly occurring chromosomal variant, which we can see in day-to-day life. So when I presented last time, the world's data was 1 in 1,000 births. But today, if I give you an Indian statistics, we are having 1 in 830 live births every year. So approximately 1.3 lakh children are born who are having this condition. And now what has happened, that the awareness is increased, and we have increased the life expectancy, which was somewhere in 1929 about 9 years. Now it's around 60 years. So the demand of the services is increasing. We have to be more vigilant, more at a giver's side. So what we have seen, that the healthcare access despite of this is still a problem, right? And the available services are not there every next door. And the people who are dealing with this, should I off my video if you all allow, because I think it's disturbing me the most.
Oh, ma'am, then you can. Otherwise, we are looking at your screen. So, I mean, for your presentation, so it's not a disturbance.
Disturbing you all also?
No disturbance for us. But
disturbance.
if
Okay,
it
then
is
it's fine.
disturbing,
Then it's fine.
okay.
Okay. So again, continuing. So the parents who are having children who have Down syndrome, they're trying to reach to different places. Now they need team of action. The team is not available in holistics everywhere. So parent has to go for one therapy one place, one therapy another place, one therapy another place. So they are facing difficulty because definitely the travel is there, travel time is there, expense is there. So these are the challenges which we are facing in day-to-day practice, and a parent is facing in day-to-day practice. So there's a small little attempt, the Another Care Clinics and Rehabilitation Center, right, which provides all, as ma'am said. I'll not go into the advertisements, generally speaking. Let's come ahead, right? Let me come into the factors which we have. We have children which have different type of permutations and combinations of the symptoms and the signs which we find in the children. These are the common list. We all have some self advocates sitting at home, and we know some or the other presentation we have in our child too. Either they have a growth failure, they have a flat posterior head. If you can see in the down figure, so there's a flat head, the ears might be abnormal, broad flat face, slanting eyes, epicanthal eye fold, short nose, small and arched palate, big wrinkled tongue, dental anomalies, short and broad hands, and many others. These are the ones which are really pertaining to the upper part of the body, maybe head and neck, and where it brings me in concern. But holistically speaking, we should know the other things also, like there's a single ray, heart disease, intestinal blockage, umbilical hernia, abnormal pelvis, a muscle tone is diminished, and the toes are widely spread. Why these all are here? Because we need to deal with the child, not with the ENT. So we should be aware what all can happen in one child, right? Today I'll be more precise rather than dealing holistically to more towards my ENT. So these are the ENT problems what we can face in a child with Down syndrome, where ear is one thing affected. I'll deal a bit in detail, so precisely speaking. So the airway abnormalities can be there, nasal problems can be there, and obstructive sleep apnea can be there, right? So let's start with the ENT. So we recommend that all the children who are born with Down syndrome and can be assessed at the time of birth, they should receive at the time of birth an expert, opinion from a behavioral audiological person, right, the different team, and every 6 months they should be reviewed, because the milestones are changing and we need to know where they are going, right? And ENT thing also at the time of birth, but after 3 years of age we are slightly more required, because from 3 to 12 it's the time of development of the immune system, and there are things, the more symptoms will be apparent between this time. So I highly recommend that at least you should visit your ENT at least once a year to understand what's happening. So let me start with some ear issues. If we see the ear, right, the ear is divided into three important parts: the outer ear, which is still the eardrum; the middle ear, which is an empty space in the ear, right, starting from the eardrum till the smaller eardrum or the secondary eardrum, from where the nervous system and the bony system of cochlea and the nerves start. So the aspects act differently in these three. If I say the outer ear, right, so we can have anomalies of the external ear if we see. So the ear can be abnormal in the children. It can be short. Plastic surgeon can manage if required, right? However, the hair can cover. So the first issue resolved. If the child has longer hair, can be covered. If the child has smaller hair, okay. It's, you see, the cosmetic, there are other so many things. The cosmetic things don't bother much. If it bother, it can be addressed by the mean of otoplasty, right? Sometimes what happens that the ear canal, which is again the part of outer ear, it is stenosed. That means it's narrow, and sometimes it's atretic. That means there is no ear canal. You find the child has no hole in the ear, right? So if there is no hole, we cannot inspect the inside ear, and there are conditions that can bother, and there can be conditions that can start eating the bones inside, and we are unaware of that, right? So it's important that the child with canal stenosis or atresia should be followed timely, so that if there is any such thing happening, we know, because the symptoms are scanty, and we know that the ear and the brain are separated only by one single bone, right? So the moment the bone damages happen, we don't know that with how immediately the infections can travel into the brain, right? And the treatments are available for canal stenosis for cosmetic reasons and inspection reasons also, right? If I see this is a eardrum, so I'm dealing with the middle ear now, right? So this is a eardrum which is very normal. So in these children, we can have effusions. That means you can see a fluid behind the eardrum, very easily apparent, and we can have infections. You can see the pus behind the eardrum, right? So what we do, we need to, we need to know this early, because we know if there is a hearing loss, this leads to a hearing loss in a small child. If there is a hearing loss, there is a speech delay. If I say, जो सुनता है वही बोलता है. Okay, a child who listens can speak. If there is a difficulty in hearing, definitely will reflect upon speech. So in Downs, if I say the hearing loss because of this is not very high, it can lead to 40 to 50% of the loss, but 50% of loss is good enough to lead to stammering, stuttering, and other ailments, right? So what we do, we take out this fluid and put these ventilation tubes. In the children with Down syndrome, we don't wait much before we have a lower thresholds to deal with this. Okay, right? But in other children who don't have this trisomy, we still wait for the self-resolution. But here, the structure of the skull is such that the things are difficult, right? So before I go to rhinitis, I have to finish the ear. So the inner ear, which I didn't make a slide. So the nervous component leads to sensory neural hearing losses. The children with this syndrome have slightly more commoner sensory neural losses. That means the nerve losses which are irreversible. So these children can be well treated with the hearing aids. And for me, the hearing should come to the normal for these children. If the hearing can be brought to normal, they can speak normally. So the point takeaway message is, kindly notice if there is a hearing loss, please get it tested and get it corrected by means of medication, by surgery, or by hearing aid. It has to be normal for me, for my child to go, better with the speech. Right? Okay. So now the nasal conditions. Now what happens in these children? The nasal condition, if you see the nose of a child which is normal and which is having Downs, the nasal bridge is not there. So that leads to a very small and narrow nose. Narrow nose means the airway is getting obstructed. We all know that we are actually nasal breathers, but God has given us an alternate pathway of mouth to breathe, right? See what happens in the children from 3 to 12 years. The adenoids is a lymphoid organ like tonsils that grows behind the nose. If you see, this is a normal airway. I breathe from here and the air goes like below, behind the palate, and goes into the larynx. But in a child who has the adenoids are placed behind the nose, it grows like a mask. Now if the air passes, it starts getting obstructed over here and the child starts snoring. Okay, and the airway is meager. Now what will the child do? It will start breathing from the mouth. The child who becomes a mouth breather, children are obligate nasal breathers. If they breathe from the mouth, the shape further changes, shape of the mouth, the airway further becomes narrower, and they start the palate, okay, if I mark the palate, so this portion starts becoming higher, so that in the mouth the space becomes more towards the breathing. So the child gets adenoid fishes. Now over that, if I see the bridge of the nose is narrow, so I make this also narrow. So what happens? There are two-way difficulty into the breathing. So the breathing is further hampered. So these children are more prone towards infection of this adenoid tissue, infections due to less aeration into the nasal cavity, and that leads to inflammation inside the nasal cavity known as rhinitis. There are more watery discharge, the nose will be always, having flowing discharges, and the infections can further lead to fevers and difficulty in swallowing, and can further lead, we know the ENT is connected. This is connected, nose, throat, and the ear, all three are connected. So more ear infections, more effusions as we learned earlier, and more chances of infections which lead to the bony destructions, right? So what do we do right? We have three important things. We have a medical management. We can deal with the adenoids by virtue of by means of adenoidectomy, or we can go into the sinus surgery. But when is the role? It is to be decided by an ENT surgeon, right? The role is not for every child. Though till 17 years of age, we don't like to touch the nasal bone, and we don't like to do any sinus surgeries because the face is still growing. So that is a take home message, that we are not going to operate for sinuses at a very early stage. Please hold on, wait. Okay, right? So these children lead to sleep apnea. What is sleep apnea? Sleep apnea is a condition where when we sleep, the tone of all the muscles go low, and the breathing that happens is not adequate, right? The airways collapse and the oxygenation of the body is not good. The child is snoring as a symptom, and the oxygen is required for for our brain, for our lungs, for our heart, for every part of the body. Every artery, every arteriole needs to carry the oxygen, which is less in sleep apnea. That can be detected by a sleep study, right, which is known as polysomnography. We put the leads on the body, and we get polysomnograph, which tells the how much sleep apnea is happening. That means how many times the cessation of breathing is happening during the sleep. That means when the oxygen is going very low. Okay, so the moment the oxygen goes low, the child wakes up. Then after that, again the oxygen is better, right? The child sleeps again. So the cycle keeps happening, which we can find on sleep apnea. And in the morning, what we find, my child is never, it's drowsy, is never active. So we find that there is low activity, always tiredness on these things. Why this sleep apnea is happening? Because of the craniofacial structures. The skull is different in shape, the tongue is large, the nasal passage is narrow, upper airway can be obstructed, right? So all these factors lead to difficulty in maintaining the oxygenation during the sleep. So what does this affect? So as I told, that it is the oxygenation is required for full body. So all the symptoms which the child is already having in Downs will aggravate. They become early diabetics, they become early hypertensives, right? The heart disease chances are earlier if they are having obstructive sleep apnea. The hearing losses are more, and so on, right? So the sleep apnea has to be addressed. If I go back to the slide, these children have retrognathia, hypotonia, microglossia. Three terms. Retrognathia means the jaw is retracted, right? In this case, we have to meet a maxillofacial surgeon for elevation, or we pull the jaw forward, right, so that the airway is maintained. For hypotonia, the tone needs to be increased. We have to work with speech therapists and deglutition therapists. And for macroglossia, the tongue is higher, we need to go with tongue reduction surgeries, right? So and now coming to the throat, that is the larynx. There are high chances of subglottic stenosis. But what is subglottic stenosis? So we have vocal cords, we all know. So the area of the vocal cord in technical language is known as glottis. So subglottis is something below the vocal cord. If I see this specific slide, if you can see, this is vocal cords, and below this there is no space. This is the endoscopic view where we are seeing into the airway. See, there's a pinhole airway. You can imagine how the child can breathe. So it is an acute emergency actually, because when it's gradually increasing, or we come, if the child is born with this, immediately we have to address, otherwise the survival is difficult. So up to 3 millimeters of opening can be survived by any person. Less than that, it's not feasible to survive. We have to address that on an urgent basis. If you can see, this is the airway. Now see how the tissues are increased, and there is a narrowing of the airway, right? So subglottic stenosis needs urgent tracheostomy sometimes. That means we make a hole in the throat. So what we do, we make a hole here in the trachea. So upper part is bypassed. Once we make a hole and do the tracheostomy, the upper part can be dealt with. After that, we can release this stenotic segment, and after that, the tracheostomy can be closed. Okay, right? So what happens that nowadays the treatment is aggressive, as we have dealt with or I've given overview about some nasal conditions, some oral conditions, sleep apnea, some laryngeal conditions. So we are more aware and we can do aggressive treatment. The parent also are now more aware. They are more intelligent to understand that their child needs an aggressive treatment. And due to this, I must congratulate that we are now having less chances of hearing loss. We have better control on the nasal conditions. We are more well versed with sleep apnea. We are more acceptable towards the CPAP machines and all, right? And the sleep disorders are better managed, right? So again, I say that the DS patients, see, now it is criteria for every child, the neonatal assessment of hearing. I request all DS patients, along with normal also, we must go an assessment at the neonatal period also. They need to follow with the hearing assessments with time, because a child have, may have this thing and is not able to tell. We must know that Down syndrome, unfortunately, is related to slightly lower an IQ than a normal child. So it's more difficult for the child to understand that what he's passing through. So we need to know, investigate, and understand how we can help the child. So, I personally think that the lower IQ is again subject to the lower hearing, lower speech, lower oxygenation, and lower development of the brain with time. Understand? So so the aggressive treatment for the hearing is really very important for giving them more speech and language development. We all know that by the year of 5, the brain development is there, fixed. After 5, we don't develop our brain much. Okay, we are maintaining whatever we have developed. So in that period, up to 5 years, if we can give best to our child in all the things, be it a hearing, be it a therapy, be it other ENT ailments to be treated, I can assure that after 5-year child will be much better than a child who has not been addressed with these conditions, right? The other medical conditions, as I have told earlier also, are also to be addressed right timely to give them a better quality of life as an individual. They need to stand and sit in the society, communicate with all normals. If they are well versed with all these things, they can become better human beings, better individuals, right? So early intervention programs are really important. Early intervention we give less than 5 years. After that, intervention is definitely there, and it's a team management. Nobody alone can do, right? We all have to move hand in hand along with the parents. If I say it's the team of doctors, therapists, special educators, sorry, they're staying for a little while. You are the biggest team, because after 45 minutes of mine, 24 hours, 23 hours are yours. So you are the biggest part of the team. Hold the hand of your child and move ahead, right? And that's all with my presentation. So we can actually do something for our children and succeed. We should never give up with the things. Thanks a lot for today. Thank you.
Thank you so much, Dr. Geeta. And it really makes me feel so good that when you come across a person who understands the all underlying medical condition with the diagnosis of Down syndrome well, because things can be interrelated, and it might also give results when addressed together. So Parul will agree with me that having such experts with us is it's like having treasure in our hands.
बिल्कुल हमें ये कहने के लिए बार बार कोई चाहिए कि हाँ ये ठीक हो जाएगा, और उस चीज में अपडेट एजुकेशन भी हमें चाहिए, अपडेट जानकारियां भी हमें चाहिए होती हैं। तो ये बहुत जरूरी है। मुझे मुझे लगता है जरूर हमारे दोस्तों को इससे हेल्प होती होगी। तो आपके जो भी सवाल हैं आप फटाफट से पूछ सकते हैं, हैंड रेज कर सकते हैं, तो 1 by 1 आप अपने आप को अनम्यूट करके सवाल अपना पूछ सकते हैं, या फिर चैट बॉक्स में आप अपना सवाल भेज सकते हैं।
Yeah. Purva has put a question, so I will read it. If something needs to be added, Purva can unmute and ask. Dr. Geeta, the parent writes that if adenoids are a bit bigger and facing no issue, then what needs to be done? And can we treat them, or let it be like that only?
So, ma'am, see, the adenoids, we have very standardized criteria when to operate and when not to operate. See, the symptoms right now might not be there. Suppose, so when we do an X-ray of an adenoid tissue, we have a mild, moderate, or severe hypertrophy. You might not be feeling any symptom. If there's a moderate to severe hypertrophy, I highly don't recommend, because especially in children with Downs, because we know that we have craniofacial anomalies. A mild adenoid not leading anything doesn't matter, because as your child will grow, it will further lead to changes in the facial structure, number one. Number two, underlying hearing effusions, the middle ear effusions, you might not even be knowing that my child is not hearing well. He might only be presenting as he's not very intelligent in the class, and you are just subjecting it, oh my god, my child is Down syndrome, is slightly delayed. No, but we need to see the child. We need to comprehensively assess his hearing. His ear is to be checked, seen, and if the size of the adenoids, there are criterias, and if the child is getting infections in those adenoids, there's a criteria for that also. If we have 3 to 4 times an infection in the adenoids per year for 3 to 4 years, or more than 7 times a year for 1 year itself, we should not keep, 13 years, the adenoid will definitely go away, but what loss it does has to be seen. So we become businessman. Abhi nafa kya hai, nuksan kya hai, we have to, see. So just simply adenoid hypertrophy is not a criteria. We have to look at holistically what all it is doing to the child, which might not be just a symptom, might be a sign too.
Yeah, like doctor also mentioned during her presentation that it is difficult sometimes for most of the time for persons with the neurodiverse needs to be able to actually explain whatever they are experiencing and whatever it is making them, uncomfortable, or, making them feel a little low. So an aggressive diagnosis and follow-up is most important. See, she says thank you, and Usha has raised hand. Usha, would you like to unmute and ask question? Yes, Usha. Now we can't hear you. Usha, we cannot hear you. आपको audio issue आ रहा है कुछ. You unmuted, but we can't hear.
उषा, आपका माइक्रोफोन काम नहीं कर रहा है, आप प्लीज उसे चेक कर ले एक बार, देखिए क्या हो सकता है। तब तक हम कोई दूसरा सवाल ले लेते हैं।
Yes.
तो और कोई सवाल है आपका तो आप पूछ सकते हैं। यस,
Yeah, one more question in chat box. It says, Madam, for a year-old baby, apart from BERA, what are the tests that needs to be done for the ear and nose?
So BERA is one test that tells us the status of hearing at that time. But as the child grows, we cannot keep doing BERA every time, because number one, it needs sedation. Number two, when we do a BERA test, it's pretty expensive. It needs the child sleeping and long time. So what we already know one status for the child by the BERA. Now we need to regularly follow up that child. So each time ENT examination of the ear is to be done. That's the first important test. If you don't do an ear examination, it might be the simple wax that's leading to the child having a hearing loss, and then the ear effusions are to be looked for. And as the child, see, effusion we can clinically determine, we know itself that the child has conductive hearing loss up to the level of 45 to 50 also, right? If my clinical examination says that there is an effusion, I treat without going in for any test. Okay, so I know how to, then there is an impedance audiometry that confirms the parents' doubt. What is, are we going on right line? Because you are not seeing that. If you want to see endoscopic examination, that is otoendoscopy, is definitely available. We can show you on screen what we are talking about. And if your child has an impedance audiometry, which is 1 minute test, we can, we can follow up the effusions, we can diagnose the effusions, and once we treat the effusions, we can follow up their, progress also, right? Because when we put the ventilation tube, they are just 6 to 9 months. So if the child is cured after that or might need again, is another issue which can again be helped with, impedance audiometry. We can have eustachian tube function tests also that tells us whether our eustachian tube is functioning well or not. And for the nose, definitely nasal endoscopies help us when required. 1-year-old baby, why should we be going for all these things? Symptoms are good enough. If I say a thorough examination by ENT will give you so much of an information, we subject our children to minimal investigations only when required. There is no point, bothering the little baby, right?
Yes.
So
Sometimes more information can be overwhelming, and sometimes you are looking for things just to rule out nahi hai, nahi hai, nahi hai. But as rightly mentioned by Dr. Kathuria, we need to be more vigilant, because here is something, when you are very observant with your child, small baby, you can make out. Even doctor will ask you, does it respond to a light or a sound or your voice or your call? You take the name of the child, does the child looks, or look for it from where voice coming. So as rightly mentioned, we do not trouble the child much, but clinical examination is important. And for that, you need to see a good ENT expert. Yes, Usha, you are back.
Before that, I want to say something also again.
Yes.
Just 1 minute.
Usha? Is it Usha?
Yeah, good evening, ma'am. आ रही है आवाज?
आ रही है।
मैम, मेरी डॉटर 9 years की है. एक्चुअली मैंने आज से 3 साल हो गए होंगे, बेरा टेस्ट कराया था. तो उसके लेफ्ट जो ईयर है उसमें मतलब बहुत ही मामूली सा आया था कि उससे थोड़ी सी कम सुनाई देता है. लेकिन अभी क्या है, मैंने उसका बेरा टेस्ट नहीं किया, बस उसके टॉन्सिल और एडिनोज काफी बड़े हुए हैं. तो मैंने एम्स में दिखाया था. तो उन लोगों ने बोला था कि अभी एक स्प्रे दिया था कि वेट करो, नहीं तो फिर सर्जरी करेंगे. तो क्या सर्जरी की जरूरत है?
मैम अगेन द सेम थिंग. सी 9-year-old चाइल्ड, उसके फेस में कितना चेंज आ गया. उसको हियरिंग लॉस तो ऑलरेडी है, यू अंडरस्टैंड, है ना? सो इट्स मोर ऑफ द टाइम वो कंडक्टिव लॉस होता है, मींस एडिनोइड टॉन्सिल की वजह से. सी एम्स इज एन इंस्टीट्यूट व्हिच इज फुल ऑफ पीपल, यू अंडरस्टैंड. वहां पे डेट मिलना, और वो भी एडिनोइड टॉन्सिल की 2 साल की स्टोरी है. वो 2 साल तक आपके बच्चे का एडिनोइड जैसे ही मॉनिटर हो जाएगा, पर वो पीछे से क्या करके जाएगा. सो आई रिक्वेस्ट, इफ इज फीजिबल, to have a nearby ENT opinion, and if surgery is required, more of clinical examination is required. If your child needs a surgery, see spray से 3 months. Any child for nasal condition, adenoid condition, अगर 3 महीने में आपका बच्चा कंट्रोल में नहीं आ रहा है, so you clear cut indication into the surgery. अगर मैंने 3 महीने का ट्रीटमेंट नहीं दिया, मैं स्ट्रेट सर्जरी कह रही हूँ, तो मेरे पास वैलिड रीजन होना चाहिए why I'm suggesting surgery. Right? So if you have been suggested surgery, that means you actually need surgery, right? And another one thing I want to add for all my parents and their children, right? It's the time of IT, and we all are going into shortcuts by the platforms. Ma'am, online consultation de do. I really request, आज नहीं, कल नहीं, परसों नहीं, clinical examination का कोई second thought नहीं है. There is no shortcut towards that. So doctors carry eyes in their hands also. I touch the baby, I understand. They carry ear in their eyes also. That is how we are being trained for our clinical skills. आप कितना भी IT ऑनलाइन कर दो, आपको एक एंटीबायोटिक का कोर्स मिल सकता है, क्योंकि पेरेंट इंसिस्ट कर रहा है. वी आर बीइंग फोर्स्ड टू गिव, बट आई रियली रिक्वेस्ट, आपके बच्चे को शायद कुछ भी ना चाहिए हो, ठीक है? एग्जामिनेशन इज वेरी इंपॉर्टेंट. प्लीज डोंट do shortcuts for your children, that can be harmful.
Very important, very important. We need to reiterate Parul time and again to parents.
बिल्कुल बिल्कुल बिल्कुल, और हमें ध्यान
मैम,
रखना
एक क्वेश्चन हो रहा है
हाँ उषा,
जी।
मैम, ये बैरा टेस्ट क्या हमें रिपीट कराना होता है?
मैम 9 साल के बच्चे में बैरा टेस्ट नहीं, प्योर ऑडियोमेट्री की जाती है until unless
Okay,
your
ma'am.
child's IQ is as low that he cannot attempt audiometry. So 4 साल के बाद हम बैरा से पहले ऑडियोमेट्री करते हैं, 9 साल के बच्चे में तो ऑडियोमेट्री इफ until unless there are mental issues, right?
ठीक है मैम।
पर दिखाई लीजिए
ऑडियोमेट्री
उनका।
उनमें भी हम ट्राई करते हैं, पहले में ऑडियोमेट्री इज डन, इट्स बेटर, राइट?
ओके मैम, थैंक यू।
या सो उषा, क्लिनिकल चेकअप डॉक्टर के पास, जैसे उन्होंने बोला उनके हाथों में भी आंखें होती हैं, वो बच्चे को छू के महसूस करके भी बता सकते हैं कि शायद इसको ये प्रॉब्लम हो रही है या इस तरह का डायग्नोसिस, मतलब इट हेल्प्स देम टू डायग्नोस बेटर, राइट? सो पहले ये चैट बॉक्स का क्वेश्चन आई थिंक वी कैन टेक एंड देन वी गो टू ओम, हिज रेज्ड हैंड. It says that my daughter Anupama is now in her 40s. Doctors here at their place have suggested sleep study, but chest physicians feels it may not help. ENT doctors also don't suggest. Any surgical interventions could improve her sleep and speech now?
So if the child is the patient is already in 40s, now no more child. See, sleep study is not a help. Actually, it's not an intervention. It is an investigation. So investigation guides us towards the diagnosis. So sleep study will tell how severe, if the patient is in a mild condition, mild sleep apnea, we might manage with smaller things. If the patient is having moderate to severe sleep apnea, so he needs intervention. Intervention in the term of whether a CPAP or a BiPAP machine, or in the term of surgery, we need to understand that only by seeing why sleep apnea. As I've given you a number of lists, we have books on sleep apnea. I've given you a small list that itself tells that how many causes of sleep apnea we may have. So each and every cause needs to be seen, addressed, ruled out, and the cause which is present is to be addressed, and then the sleep apnea has been treated, right? So first thing is that sleep polysomnography gives us, or the sleep study gives us, is it present or not? If it's present, how severe it is. Mild, okay, we can still tolerate, but not more than that, right? So it should be done, and then what for you?
Yeah, Himlata ma'am, I think your question is answered. Om, you can unmute yourself.
Okay. Good evening, ma'am. Actually, ma'am, मेरा बेटा 5 years का हो जाएगा जुलाई में, ठीक है, और अभी उसने बोलना स्टार्ट नहीं करा है. So somebody suggest me to go to ENT specialist to get him checked. हम गए, adenoids वगैरह सब चीजें, जो भी चीजें टेस्ट हुई है उन्होंने, डॉक्टर ने करा, adenoids mild है कि surgery is not required. और उन्होंने मुझे स्पीच से रिलेटेड बोला कि you just come later on. तो अब हम दोबारा से उनके पास जाएंगे, कौन सा टेस्ट कराए, क्या उनको बोले, क्योंकि my main issue is speech delay.
Right. So, ma'am, a child at 5 years of age in a speech delay, मेरा क्वेश्चन है आपसे कि अभी 3 साल, मतलब अभी जब 2-2.5 साल में बच्चा बोलता है, 1.5 साल में, अभी से 5 साल तक स्पीच पे एक्शन क्यों नहीं हुआ? Because as I told, I need early intervention. So speech.
Actually, I want to tell you why we have not gone for the speech therapy. Actually, we are living in Bhatinda. It is a small city, and wherever I went for speech therapy, what the people used to do, they used to take him inside the room and they used to say that 3 mahine lagenge at least, wait for 3 months. 3 months at least, you just tell us what a child is doing, what homework you are giving, what therapy you are doing. We are unaware what they are doing inside the room. So वो मुझे worthy नहीं लगा कि it is of no use sending a child to a room where we don't know what is going inside. कुछ तो दे, कोई वीडियो दे, कोई होमवर्क दे, कोई थेरेपी हमें बताए कि मैम पैरेलल आपको घर पे ये चीज करानी है.
So, ma'am, what we do in our center is that my speech therapist, we don't even put, the cameras. All the parents are most welcome into the room where speech therapy is given. In
Okay.
fact, it's a rule, because if you don't see the speech therapy, I said I only deal 45 minutes. Rest of the day you have to deal. If you will not learn, what will you give? Then you must have acquired another center. But now, see, the life doesn't stop. Whenever we wake up, we are, the morning is the same time. Even if at 5 years, if the hearing has been assessed, it's not the job of an ENT alone. We have to go to the speech therapist, and the speech needs to be initiated definitely. We have to work upon the speech, and it's an aggressive therapy. Ma'am, many times it's not a 2-day, 3-day, 3 months. It might take years to do speech therapy, to be very honest. I don't give this myth to my parent that please come for 15 days and we will create wonders. Ma'am, the God also creates landmarks. The child starts babbling, then understanding and speaking 1 word, 2 word, 3 word.
Yeah.
Then small sentence, multiple sentence, and the language develops. If the child has not initiated with the speech, we have to initiate the speech and give him, the insight towards, till the language. So it's a speech and language, not speech only. So he needs aggressive speech therapy under supervision.
Okay. So what I want to tell you, ma'am, he speaks two meaningful words, mummy and papa. He speaks two meaningful words, and these two words he's speaking since last 2 years.
That's why, ma'am, think about the child's language age. क्या 5 साल का बच्चा मम्मी पापा बोलता है? It is the age of 1.5. So if I say the age of your child by speech and milestone is only 1.5 years. So we need to bridge the gap between that 1.5 years and the 5 years, So that, how will you bridge the gap? You have to go in for intensive speech therapy with the correct speech therapist and insist that I want to be part of the therapy, and I need home plans every day, 24 hours, हर दिन, हर पल आप बोलेंगे उसके साथ.
Okay. Thank you.
थैंक यू वेरी मच. ओम के नाम से आपका नाम क्या है मैम, आप जो बोल रहे हैं? निशा, यहाँ पे मैं एज अ पेरेंट आपको एक बात कहना चाहती हूँ कि जैसा डॉक्टर ने कहा है, बहुत ही सही उन्होंने कहा है कि 5 साल का बच्चा हो गया और अभी तक उसका स्पीच थेरेपी क्यों नहीं हुआ है. अगर वो मम्मी पापा बोल रहा है तो वो और भी बोलने के लिए तैयार है. हम आपकी प्रॉब्लम समझते हैं कि आप एक ऐसी जगह पे हैं जहां पर स्पीच थेरेपिस्ट के साथ आप कंफर्टेबल नहीं है, वो आपको पसंद नहीं है. भटिंडा के आसपास और भी बहुत सारे शहर होंगे, आप वहां जा सकते हैं. एक बार किसी अच्छे स्पीच थेरेपिस्ट से उसका असेसमेंट करा ले, उसके बाद उनसे प्रोग्राम ले ले. स्पीच थेरेपी कोई ऐसी चीज नहीं है जो डॉक्टर या थेरेपिस्ट आपके बच्चे के अंदर रख देगा. वो हमें ही करना होता है, सिर्फ जाके सीख के आना होता है. बिकॉज उसमें बच्चे की बोलने की एक्सरसाइज है, उसकी टंग की एक्सरसाइज है, उसको आपको फूंक मारना सिखाना है, उसको आपको सकिंग सिखानी है. इन्हीं चीजों से.
पारुल जी, इंटरप्टिंग यू. पारुल जी, स्पीच थेरेपी हर दिन एक नया लेसन प्लान है. स्पीच थेरेपिस्ट के बिना पेरेंट अकेले नहीं कर सकता.
तो वही मैं कह रही हूँ, जाइए ना भटिंडा के आसपास कोई शहर होंगे, दिल्ली आइए ना, आप यहाँ पे हैं.
स्पीच प्लान से नहीं चलेगा मैम, वी हैव टू गिव.
अरे स्पीच प्लान से चलता है, मैंने खुद किया है. 5 साल मैं बिजनौर से दिल्ली आई हूँ अपनी बेटी के लिए, और मैंने यहाँ से स्पीच थेरेपी ली है, और 180 किलोमीटर रोज आना और जाना करके. ठीक है, 15 दिन.
रोज दिल्ली आना जाना करते थे आप?
रोज दिल्ली आना जाना तो अलग करती थी, वो स्कूल के लिए था. डेली स्कूल भी लेके आती थी, वो अलग है, छोड़ दीजिए. लेकिन स्पीच थेरेपी के लिए 15 दिन में एक बार डॉक्टर से भी मिलती थी. वो एक बार आपको प्रोग्राम देते हैं. ठीक है, एक्सरसाइज करानी होती है तो आप करा सकते हैं. ठीक है, थोड़ी मेहनत करिए, बच्चा जरूर बोलेगा. जो मम्मी पापा बोल रहे हैं वो आगे भी बोलेगा. असल में क्या है समीक्षा, थैंक यू निशा, होता क्या है, हम अपने बच्चे की भाषा समझने लगते हैं. इनका बच्चा बोल नहीं रहा है लेकिन वो कम्युनिकेट करता है. इन्हें भी आसानी हो रही है, उन्हें भी आसानी हो रही है. पानी मांग लेता होगा किसी तरीके से ना,
वो अपने आप बॉटल पकड़ता है, आरओ की टैप ऑन करता है, तो वी अंडरस्टैंड कि हाँ उसको पानी चाहिए.
यही हो रखा है ना.
अब वो फ्रूट्स रखे, फ्रूट्स के बास्केट में से जाके खुद फ्रूट लेकर आता है खाने के लिए.
निशा, आप ना बहुत नजदीक हो, आपका बच्चा जानता है पानी क्या है, फ्रूट्स क्या है, सिर्फ उसके मुंह में वो वर्ड्स डालने हैं. बहुत नजदीक हैं आप. किसी अच्छे स्पीच थेरेपिस्ट को ऑनलाइन कंसल्ट कर लीजिए. एक बार मिल लेने के बाद किसी भी शहर में आ जाइए, दिल्ली आ जाइए, नोएडा आ जाइए, मेरे पास रहिए 2-3 दिन और यहाँ थेरेपिस्ट से मिलिए. ठीक है, और वापस जाके काम करिए फिर अपने बच्चे पे. ऐसा कुछ भी नहीं है जो एक मदर नहीं कर सकती है. थैंक यू
पारुल मैम, थैंक यू.
बिल्कुल आइए मेरे पास, ठीक है।
गीता मैम,
Okay, thank
your information center का एक बार either you display the slide or put it in the chat box, because a parent from Delhi and NCR wants to have your contact number and of course location. So, okay, another parent says thank you for your guidance, and Rashmi here wants to ask, by the time that the center and the address and the phone number details are shared on the screen, please note down parents.
आप
And
फोटो ले लीजिए आप सब इनका फटाफट से।
Yes, and I take this question. It says that पार्थ शायद बच्चे का नाम है, रश्मि बोल रही है कि पार्थ को एडेनॉइड्स बड़े हैं, नोज की बोन भी लार्ज है, जो बाहर से दिखती है, सोते समय हम लोगों को पेट पर हेड रख के सोता है, मेदांता दिखाया था, डॉक्टर ने ऑपरेशन के लिए बोला था, प्लीज सजेस्ट मी।
मैम अगर नेजल बोन टीडियस, एज कितना है मैम चाइल्ड का?
रश्मि, व्हाट इज द एज ऑफ पार्थ?
मैम 9 years.
9 years.
9 years. मैम सी एडिनॉइड का सर्जरी पहले, right? So once adenoids are corrected, let's see how much your child improves. अगर child improve कर रहा है, very nice. Because as I said कि nasal bone को until unless a very dire emergency, I don't like to touch before 17 years of age. Right? It is not to be. Right? Most of the times अगर adenoids निकल गया ना तो एयर में बहुत अच्छा हो जाएगा, and we will find that the child is breathing well. Then we can monitor the child. And once required we'll think of, क्योंकि जब bone बाहर है, that means caudal dislocation आप कह रहे हैं, I can understand that, right? It's not always the cause, हमारे 80% लोगों में नाक की हड्डी टेढ़ी होती है, राइट? लेकिन 10% सिम्टोमेटिक होते हैं जिनमें प्रॉब्लम आती है, उन 10% को आइडेंटिफाई करके ट्रीट करना चाहिए, अदरवाइज लीड्स प्रॉब्लम। लेकिन उसकी भी एज 17 years होती है, बिकॉज द फेस इज ग्रोइंग, द मैक्सिला इज ग्रोइंग एज द एज ग्रोज, राइट? तो वो कैविटी अपने आप बड़ी हो जाएगी, लेकिन एडिनॉइड्स डैमेज करके जाएगा, वो आप 9 years की एज पे यू मस्ट 13 years तक वेट नहीं करना चाहिए, इफ बोथ आर
तो ऑपरेशन मैम करा लेना चाहिए
मैम एडिनॉइड्स का। यस, इफ इट्स देयर, इफ यू वांट to you can send me the x-ray reports and all the reports, मैं आपको उसके ऊपर जो मुझे समझ आएगा regarding the child, I can tell you. You can mail me or WhatsApp me, but एक बारी WhatsApp पे बता दीजिएगा that you have mailed me the things,
Yes.
ओके मैम। मेदांता में डॉक्टर के हंडो को दिखाया था तो उन्होंने यही बोला,
very good surgeon, right? There is no doubt in that.
ओके, थैंक यू मैम, मैं सेंड कर दूंगी।
Sure, most welcome.
Okay, and I think we are almost time, and today we have been punctual. There are questions, we could take all the questions, so many addressed. And yes, the contact details is on screen. You want to take a screenshot, as Parul mentioned, that's the easiest way to keep. But do not apply the easy way for your child's diagnosis and your child's treatment. As Dr. Geeta said, ki quotes mein aggressive. So because it leads to many milestones, the ENT aspects of a child. For which year should we start the speech therapy? I think, see, I would like to say here that as a parent, that parent of 5-year-old, a parent of newly born child, 1-year-old also is asking questions, and 40-year-old also adult parent is also asking, can we improve speech anytime? Ma'am said that jab jago tab savera hai.
Challenges are there, restrictions are there, parents' efforts are there. As I can see that Parul ma'am has been a very passionate parent कि मुझको करना ही करना है. So I feel if that feeling is there in every mother, wonders can be done. So mother needs to find कि मेरे को करना है time से. So we can help. See, always distance might be, see, obstacles are there everywhere. उनको पार करना ही तो जिंदगी है ना.
बिल्कुल बिल्कुल।
So nicely put. उषा, आपको कुछ ऐड करना है, पूछना है?
यस मैम, एक सेकंड बेटे। मैम मेरा एक क्वेश्चन था कि मैंने एक डॉक्टर को दिखाया था, तो एक्चुअली राधा के बहुत कफ एंड कोल्ड रहता है, और जिसकी वजह से रात को वो सोती भी कभी पेट के बल है बैठ के, हमारे पेट के ऊपर सर रख के सोएगी, उसमें ऐसा लगता है उसे सांस नहीं आ रहा हो। तो उन्होंने बोला था कि अगर आप ये मतलब इसका सर्जरी से निकलवा भी देंगे तो सेम प्रॉब्लम रहेगी, कफ एंड कोल्ड इसका ठीक नहीं रहेगा, मतलब वो ऐसा ही रहेगा, उससे कोई फर्क नहीं पड़ेगा। तो ऐसा है क्या?
मैम अगेन ये एक शायद लेमैन को समझाने वाली टर्मिनोलॉजीज हैं। अगर सी कॉज क्या है प्रॉब्लम का वो समझना है। अगर कॉज एडिनोइड्स है तो ठीक हो जाएगा, अगर कॉज एलर्जिक राइनाइटिस है तो हम एलर्जीज पे काम करेंगे, काम करना पड़ेगा
अच्छा,
उस चीज के ऊपर
ठीक है।
जिस वजह से प्रॉब्लम आ रही है। ठीक है, अगर उसके नोज बेंड है या कुछ ऐसी वाली इशू है तो हमें समझना पड़ेगा कि नेजल स्प्लिंट्स एंड ऑल तो काम नहीं करते हैं, राइट। सो
ठीक है।
until unless उस कोल्ड एंड कफ का, और कभी कभी कोल्ड एंड कफ जो होते हैं जो एलर्जिक जैसे ब्रोंकाइटिस अंडरस्टैंड द कॉज एंड देन टेक। ठीक है, सिंपली कहने से कि ये हो गया और ये हो गया। इट्स रियली शेड्स आर नेवर व्हाइट एंड ब्लैक, दे आर ऑलवेज इन द फेज ऑफ ग्रे। ठीक है, तो पूरी रेंज है सिम्टम्स की, डायग्नोसिस की, और राइट टाइम भी राइट ट्रीटमेंट की, आई मस्ट से, है ना मैम। सो इट नीड्स टू बी एड्रेस्ड अकॉर्डिंग।
या उषा, आई थिंक आप एक बार मैम जब प्रेजेंट होंगी दिल्ली में, यू मस्ट गो टू अ क्लिनिक, सरिता विहार में है, तो आप जा सकते हैं मैम को एक बार
ठीक है।
एंड आई थिंक शी विल बी एबल टू गाइड यू बेटर।
ओके, थैंक यू।
समीक्षा, यहाँ मैं एक चीज ऐड करना चाहती हूँ, क्योंकि उषा ने जैसे बात स्टार्ट की है एलर्जी की एंड कफ एंड कोल्ड की।
Yes.
हमारे साथ रश्मि मैम है, मैं बहुत सारे पेरेंट्स को उनका नंबर देती हूँ कि आप उनसे बात करिए। कई होम रेमेडीज रश्मि मैम बताती हैं इसके लिए, एलर्जी के लिए, इम्यून सिस्टम को बूस्ट रखने के लिए। हमारे बच्चों के जो कफ एंड कोल्ड उनको बहुत जल्दी जल्दी होता है, तो क्या घरेलू नुस्खे हो सकते हैं? रश्मि जी जल्दी से बता दीजिए।
अभी डॉक्टर सामने बैठे हैं, हम ये ना करें, बाद में हम बात कर सकते हैं।
नहीं,
डॉक्टर साहब
अगर आप
इसके फेवरेट एलर्जीज में
तो एलर्जीज के लिए हम घरेलू ये उपाय यूज कर सकते हैं, बट फॉर अदर इश्यूज आई थिंक इट्स बेटर इफ वी कंसल्ट ENT specialist, and ma'am is a very good pediatric specialist. So I will definitely recommend कि please एटलीस्ट वंस इन अ ईयर आप चेक करवा लीजिए, आप इनके पास नहीं और किसी के पास भी, बहुत जरूरी है। तो वी नो लाइक रिकॉर्ड हमारे सामने रहता है तो बेटर रहता है कभी भी, कि लास्ट टाइम करवाया था तो क्या इश्यू था, अभी इस बार करवाया क्या इश्यू है। तो वो एलर्जीज का वो तो हम बाद में करेंगे।
चलिए ठीक है, ये भी सही बात है। समीक्षा, एक अलग से हम सेशन जरूर करेंगे बहुत सारी घरेलू।
वन मोर थिंग आई वुड रिक्वेस्ट द पेरेंट्स, लास्ट टाइम भी मैंने आई थिंक ये किया था कि जब हम डॉक्टर के नंबर्स और ये सब शेयर कर रहे हैं आपसे, तो रिक्वेस्ट टू ऑल द पेरेंट्स कि प्लीज पहले एक मैसेज भेजिए, डायरेक्ट कॉल करने की वजह पहले मैसेज भेजिए, व्हाट इज द गुड टाइम टू कॉल और व्हाट इज द गुड टाइम टू मीट यू, है ना। डायरेक्ट हम बिजी में, डॉक्टर बिजी रहती है काफी, सो इट्स बेटर इफ यू सेंड अ मैसेज फर्स्ट एंड देन मीट हर और टॉक टू हर।
बिल्कुल बिल्कुल बिल्कुल।
This is my I'm writing my number here. These are all my reception numbers. अगर बहुत emergency है तो मैं अपना नंबर भी दे रही हूँ, right? So
Nice of you, Dr. Geeta. And yes, it's a humble request. Please, Prabhuda, आपको आपने hand raise किया. You want to ask something?
नहीं, मैं
आपका
वो छोटा था तो मैं उसे
voice
मेरा
clear
बेटा
फिर से बोलिए।
मेरा बेटा 14 इयर्स का डाउन सिंड्रोम चाइल्ड है, शाश्वत जैन। एक्चुअली वो प्रबुद्ध जैन छोटा बेटा है, उसके नाम से मेरा ज्वाइन हो गया शायद।
हाँ जी।
तो मैं उसे अश्वगंधा खिलाती थी, पिंच ऑफ अश्वगंधा एट अ वेरी स्मॉल एज। तो जैसे अभी विंटर समर्स का टाइम है तो मदर्स चाहें तो पिंच ऑफ अश्वगंधा विथ हनी, तो ब्रेन बूस्टिंग में बहुत अच्छा हेल्प करता है ये, ब्रेन टॉनिक की तरह।
आई थिंक
तो
पारुल
मैंने सोचा
10 की होम रेमेडी का सेशन करेंगे एक दूसरा।
करना ही पड़ेगा।
बट फिर भी आई विल ऑलवेज रेकमेंड कि अपने डॉक्टर से बात करके ही करिए, हर बच्चा सेम नहीं होता है, सबको सब कुछ सूट नहीं करता है।
बिल्कुल
So please always refer your doctor first and then you can do whatever you want to do, home remedy.
पहले पता होना चाहिए कि बच्चे को प्रॉब्लम क्या है,
क्या प्रॉब्लम है। यूं ही कुछ वो हो रहा है इसलिए भाई किसी ने बोला इसलिए दे दिया, ऐसे नहीं करना चाहिए, ऐसे रिस्क नहीं लेना चाहिए।
Exactly. my drill with my son used to be कि उसको मैं जो दवाई खिलाती थी पहले मैं खुद भी खाती थी to understand that how it flavors and how much bitterness or how much flavor can stay in my mouth and how I will react to it. So that is how my way of
राइट
giving
मैम,
medicine works.
हर मदर यही करती है। मतलब मेरे बेटे को पैर में गोखरू है तो मैं उसके स्लीपर्स खरीदने के पहले खुद के पैर में डाल के देखती हूँ कि कंफर्टेबल है
So
कि नहीं है,
nice. So nice.
क्योंकि वो पहन नहीं पाएगा, वो बता नहीं पाएगा शायद।
Yes. Thank
ये
you
तो
so
सही
much,
कहती हैं।
Mama, प्रबुद्ध की मम्मा। मैं आपका नाम रजिस्टर नहीं कर पाई for adding, and we are so grateful to Dr. Kathuria that despite being out of place, despite being knowing that there can be network issues, you consented and joined. We really want to give you a round of applause for that. And
Yes, बिल्कुल।
very
और
very blessed to
अपने
have
कुछ
you.
कुछ एंगेजमेंट्स भी होते हैं, कहीं बाहर हम गए हैं तो हमारा पूरा शेड्यूल फुल रहता है समीक्षा।
Exactly, Parul. Thank you so much, Doctor.
Thank you so much.
Yeah.
थैंक यू सो मच डॉक्टर गीता, इतने शॉर्ट नोटिस पे आप आई हैं। बार बार हम वही बोल रहे हैं, हमें बड़ा अच्छा नहीं लग रहा था आपको डिस्टर्ब करना, बट इट्स सो नाइस ऑफ यू टू अग्री एंड गाइड द पेरेंट्स।
थोड़ा सा भी बेनिफिट हुआ हो किसी को, I'll be really happy.
डेफिनेटली
बेनिफिट हुआ है।
Yeah, बिल्कुल, thank you so
आपने
much.
लिखा है वो भी बहुत अच्छा कोट है जो आपने कोट लिखा है। तो दोस्तों ये सेशन यही खत्म होने को आया है। उम्मीद है आपको अच्छा लगा होगा और हमारे गेस्ट का बहुत बहुत शुक्रिया। इतनी प्यारी सी मुस्कान के साथ डॉक्टर गीता हमेशा आती है, बहुत अच्छा लगता है डॉक्टर।
थैंक यू सो मच।
सो नेक्स्ट सैटरडे हम मिलेंगे फिर से। मैं ये सेशन अब एंड कर दूं समीक्षा?
Yes, we would like to end the meeting.